Our studio guest is Crystal King. She is a nurse practitioner from Tripp Family Medicine. And gosh, I think the last time she was in studio was about 6 months ago. Is that right?
Yeah, I think so. When we were doing some
Yeah.
breast cancer
My
discussions.
gosh, that's been a while.
Yeah.
So good to have you back.
Thanks.
They
Great
probably
to
had to
be
give you
here.
directions to get back here.
I did have to look it up on Google Maps. It's been a little while.
From the north end of town to the south end of
Yeah.
town.
We live over near Filer, so I had to work my way over here.
It's not a bad drive, other
No,
than the
it's not.
deer running in the middle of the road all the time.
Yeah.
We're talking a little bit about exercise and weight loss today,
Yes.
but not necessarily always a combination of the both, right?
Yes. So actually today what I want to talk about for our topic is benefits of exercise other than weight loss. So often we think of weight loss as the first thing, especially now. Nowadays, our real focus is body image, weight loss. But the benefits of exercise are so much more than that. Obviously, those two do go somewhat hand in hand, but there's so many other benefits. But first, there's a couple things I wanted to talk to you about before we get to exercise. One is we wanted to do, I just wanted to let you know that Tripp Family Medicine, the Tripp family, is planning a vacation to Nicaragua.
Not much of a
Yeah,
vacation,
not much
though.
of a vacation, a mission. It's actually a mission project for their son's Eagle Scout project. And they are collecting hygiene kits. They're still in need of items. So if any of you listeners out there are interested in donating, you can contact the office or stop in. They have a whole list right in the entryway of things that they are looking for. And the boys are also, well, all of their kids are earning their own money to pay for this trip. And so the girls, I think, have kind of um, finished their part, but the boys are doing lawns. They're mowing lawns for the summer. So if any of you out there need your lawns mowed this summer, they are for hire. So that should be an awesome experience for them. We look forward to hearing all about it as they go down to Nicaragua.
And
So,
again, people can drop off toiletries too, as
yeah.
well, that you can take along, and you can just do that at the office.
Yep, standard toiletries, and they have a few things that aren't, in the normal standard kit. Normally, you do things like deodorant, toothbrush, soap, but they have a few other things that go along with that. So if you're interested in seeing what those are, or if you have some of those things laying around your house, they would be more than happy to take them down to Nicaragua with them.
Are there some
So
details on the website too, and the Facebook page about these
I
things?
think so. I'm pretty sure on the Facebook page. I don't know if the website has it, but I know the
Right.
Facebook page has some information
And of
about it.
course, for
Yeah.
people listening, Tripp Family Medicine, Tripp is with two P's. So if they go to Facebook, they should just keep that in mind too.
Perfect. Yep. And Tripp Family Medicine Twin Falls, they're the ones, so that it should pop right up. So.
And I guess if they called the office too, they could get a list of
Yes.
things that
Yep.
are
And
needed.
yeah, you can call the office 933-4400. Or like I said, stop in, check the Facebook page. We would welcome any donations to that. So.
It seems to me, I mean, and I got this impression from talking to some people
Yeah.
outside of work that this is a lot of people have that there's been a good response, at least in the community, to all of this going on.
Oh, definitely. Yep. We've received great donations. And like I said, more is always better in terms of providing resources for the people that they're going to be serving down there who
And
just don't have much. So,
out in the jungle, obviously, there's no place to
mhm.
go down to the Walgreens and pick this
Yeah,
up.
exactly.
And even if there was a Walgreens, these people don't necessarily have the money to
Right.
afford a lot of these things.
Right. And travel becomes a big issue. That often they're in little tiny areas without the conveniences we have in terms of shopping. So often their resources come from humanitarian organizations. So even things as simple as toothbrushes and toothpaste.
Sure,
So
sure.
it's
Uh,
a much needed thing that we take for granted. So.
we should point out too that Tripp Family Medicine is located on Fillmore Street. For those people who are, and it's on the north side.
Yeah, it's right across from the post office. There's office buildings in there, and you'll see the big sign for Tripp Family
Yeah,
Medicine.
it's a big sign.
Yeah.
Not as big as the billboard was.
That's true, but the billboard's gone now, which is okay because my face on a big billboard. No.
Driving into work one morning, and I happened to see one on South Washington. And there's the doctor looking at me, and I thought, okay, I better work and live healthily today
Yeah,
because he's staring
it's a
at
good
me.
reminder.
Yeah.
Oh no, he can see me. He can see everything I do.
We'll talk a little bit
So,
about, we got about a minute before the break, but we're going
okay.
to talk a little bit about some of these healthy issues.
Sure. And the one other thing we were going to talk about, we'll get to after the break, is a quick review of recommended screening for women's health. I do a lot of women's health there in the office, being a female provider, and so I did want to just brush over that for those of you women wondering what you should have done, or husbands, or um, sons, or people with women in their life who want to know what screening is good for the women in their life to have
We
completed.
can note to your background
Mhm.
that you worked at one time at one of the biggest cancer centers in the country at Roswell Park
I
up
did,
in
yeah,
Buffalo.
in Buffalo, New York. Yep.
And so you have a pretty strong background in working with a lot of people and knowing what signs are and the like.
Yes, and breast cancer, I worked very specifically with breast cancer patients, so that is, a side love of mine is breast cancer screening and discussion, so, yeah, that's one thing we like to
Well,
talk
we'll
about.
talk more about that coming up in the next segment of the program. Crystal King is joining us in studio. She is a nurse practitioner at Tripp Family Medicine right here in Twin Falls, Idaho. And of course, you're listening to Better Health with Tripp Family Medicine. Bill Colley answering the telephones this morning during this segment of the show. And well, put it this way, we're warming up gradually today. Only going to get maybe into the low 60s. 53 right now, 20 minutes away from 9 o'clock. And you're listening to News Radio 1310 KLIX and newsradio1310.com. Our studio guest is Crystal King. She's a nurse practitioner from Tripp Family Medicine right here in Twin Falls. And we're talking better health today and a number of different issues. I should point out one of my old neighbors from Western New York, we both
Yeah.
have worked and lived in that part of the
Mhm.
country. She was a nurse practitioner as well, but she's living, I think, in Portland and has decided, but she grew up in San Diego, but she wanted to come back west. And I asked
Mhm.
why, and she said, because I don't have to deal with all the snow.
Yeah, Buffalo has lots, but
Yeah,
lots
when
of
you're shoveling
snow,
4
lake
feet of
effect
that to get
snow.
to work,
Yeah.
and they don't close anything because it's
Yeah.
so regular.
And it doesn't melt till May.
Right.
Yeah. The mountains.
Yeah, like the mountains here, but they don't have the mountains there are about 50 feet high and it's all snow
It's
where
all
the
snow.
plows piled it
Yep.
up.
Yep, in the parking lots.
Yeah,
Yeah.
and it just sits there and melts by August. There's a little
Yep.
pile still of it left.
Yeah.
Uh, we've been talking a little bit about, we want to talk a little bit about exercise, but you were also going to mention a couple of things about screenings.
Yeah, I wanted to talk real quickly about women's health screenings. Again, they've made changes and recommendations over the last couple years. So just to clarify and to kind of encourage you guys to have your um, kind of annual health screenings completed. The first one I get the most questions on is pap smears. And when do you need a pap smear? So I wanted to go over those basic guidelines. And obviously, certain individuals may have deviations from this. But basically, if you're over 30 years old and you've always had regular pap smears, you are okay to go to pap smears every 3 years. It can go every 5 years if you have HPV testing with it. That's testing for a virus, the human papillovirus. If that's completed with your pap smear, you can actually have a pap smear every 5 years. If you're younger than 30, pap smears start at the age of 21. Whether sexually active or not, all pap smears start at the age of 21, and those are yearly until the age of 30. Again, if there's abnormalities, then we may require more frequent screenings. The other question I often get is, I've had a hysterectomy. Do I need a pap smear? And the answer to that is no, unless you had a hysterectomy due to cervical cancer. So those are the big questions I wanted to clarify on pap smears. Also, you may get STD testing done if you're at risk for those. Breast exams, which is a clinical breast exam, that's something you would want to have done annually, which is every year by a practitioner. Um, Also mammograms. So mammograms have varying recommendations as well. Most agencies agree that starting at age 40, you should have a mammogram every 1 to 2 years. And then once age 50, it does become an annual screening test. Mammograms are great in recognizing cancers, especially early cancer. Breast cancer, again, affects 1 in 8 women. If caught early, often is so much easier to treat. So I'm a big advocate of screening mammograms, also breast exams. There's also a concern of clinical breast exams, which is or patient breast exams, breast exams, which patients do at home. 10 years ago or more, there was a big push to have everyone do their own breast exams, do it every month, same time of the month, a very routine thing. And they've kind of gone away from that because they were finding so many lumps and bumps that weren't cancer that were causing a lot of extra biopsies, a lot of time, and a lot of extra worry. So now the recommendation isn't really clear, but I like to stick with 3 to 4 times a year. Make sure you do a home breast exam. Be familiar with your breasts. Know what's normal, what isn't. So if you do notice a lump or bump, you know that it's new, and then we know we to get that checked out.
We should point out too there are variations in all of this because if you have a family history or
Yes,
you've already had an issue, your
definitely.
medical professionals are going to tell you you're on a different schedule.
Right. And that is what again why it's good to go in and talk to a healthcare provider because they can have that discussion with you depending on your family history, your genetic history. Also, history of other cancers can be related to breast cancer, including colon cancer, ovarian cancer, and others. So it's always good to have that conversation with your healthcare provider. So
I had an email from your office a
yeah.
few days ago, and it mentioned exercise and weight loss, and of course these are
Mhm.
two things that no matter if you go see I have a friend is deacon at my old church, and he told me that he had to lose 30 pounds one day because he's 73, and they said, you know, you could end up. He's got diabetes now, and they
Mhm.
said you'll be in a wheelchair at age 92 if you don't do it. And he said, I'll be 92. But
Yeah.
his point was they still wanted him to lose weight. I didn't even think he looked like he needed to lose any weight. But these are all things that we constantly are getting feedback on from medical professionals. But some people out there ask, do I lose the weight first? Do I do the exercise first? Do I do both? And sometimes the advice there can vary as well.
And it definitely does, and that it also becomes an individual thing. It depends on your individual health. So moving into exercise, one thing um, recently I've been reading studies on weight loss. Again, I don't want to talk too much about weight loss today, but a little bit on obesity in general. So in the 1980s, which wasn't that long ago, 20, 30 years ago, the state average of obesity, which is a BMI over 30, so not overweight, but actual obesity was 14 to 17% average throughout the states. Currently, today, the average throughout the states is 37%. So when we talk about, well, is obesity genetic? Is it lifestyle? Obviously, it's a little bit of both. However, seeing that great of a percentage change in the last 20, 30 years shows us there's definitely lifestyle habits that we have made and that we need to correct. And one of the big ones is having an active lifestyle. And that's what I want to talk about in terms of exercise. So I have a lot of things that exercise helps that I wanted to talk about. Improves depression, anxiety, stress, and we'll go more specific into these topics. It improves motor function, decreases risks of osteoporosis. It improves cognitive strength, also prevents cognitive decline, prevents some cancers, helps with constipation. Anyway, these things go on and on. But um, in terms of activity. Well, I always like to tell my patients, because we often talk about exercise, this is something on most of our minds, is to start somewhere. If you're not doing anything, any activity improves your life. And actually, as of late, several studies have demonstrated that small amounts, even relatively small amounts of activity, 1 day a week more than what you're doing, um, improve your health outcomes and improve mortality. So little things, again, exercising once a week can have positive, measurable benefits to you. So obviously, the more the better, and exercise is re- linear. The more exercise you do, um, the better outcome generally you will have. And again, everyone has little caveats to this. If you have certain heart conditions and stuff, again, that would require a discussion with your provider. But anywhere you start is beneficial.
I I've talked to medical professionals about this for a long time because
Mhm.
I was a thin fellow through my late 30s, and then of
Mhm.
course I was a tobacco user, cigars, pipes, cigarettes, gave it all up, and I gained weight. But
Yeah.
it turns out in my family that most people about the same age, both
Mhm.
sides of my family, uh, put on a lot of weight.
Mhm.
I saw a photograph of one of my great grandfathers when I was younger, and he was a farmer, and he was a larger man than I am. I mean,
Mhm.
but he worked on the
But he
farm every
worked hard,
day,
yeah.
and he lived to be a ripe old age, even though he probably weighed in excess of 400 pounds.
Mhm.
He just kept going, kept working, and I'm sure they didn't eat any processed foods.
Right.
And so he ended up living somewhere in the range of 80 years when in an era when people didn't live much beyond 50 on average.
I'm glad you brought that up. And again, that goes back to the topic of today, which is the benefits of exercise other than weight loss. Weight loss is great, and we all want to look good. However, the benefits to weight loss or to exercise go so much further than that. And most of these studies are independent of weight loss. So you'll notice the things that they're showing help that exercise helps with goes beyond weight loss. It's not, well, exercise and weight loss helps you feel better. It's exercise did this, exercise did this. So that's what I wanted to talk about. Um, the first topic I wanted to bring up was depression, anxiety, and stress. Um, in multiple studies, exercises it has been demonstrated to improve mood among patients with depression. Um, de- and it kind of before I go into this, because depression is anxiety, stress, these are all sensitive issues. And I don't want to say that exercise is a cure for any of these.
Right.
However, it definitely is a complementary therapy that shows a lot of good improvements for people. So, for example, in one study, it put brisk walking or jogging against the antidepressant sertraline, also known as Zoloft, which is a common antidepressant in the common class of antidepressants, anti-anxiety medications we use. And then they put that against a combination of the drug plus exercise. And after 4 months, all three groups had about the same improvement in their depression levels. But at 6 months, the people who kept up the exercise had the lowest rates of remission of depression. Um, it's also in the same study, persons who were active and became inactive were 1.5 times as likely to become depressed compared with those who maintained an active lifestyle. So again, I like that study because I think many of us can relate to this times in our life where we've been active, where we've exercised, and we felt good, and we go away from that, and we notice a difference. We notice a difference in our mood, and I think many of us know this. If you sit back and reflect on it, reflect on your activity and how it makes you feel, it doesn't take a study for you to feel this.
You've got more oxygen, though, and I guess more endorphins
Yes.
firing when you're exercising.
Yeah. So, why it works? These are kind of some theories for why we think exercise works. The first thing is we know it releases the feel good brain chemicals. These can include neurotransmitters, endorphins, endocannabinoids, is what they're called. It reduces immune system chemicals. Those are known to worsen depression. And so, by reducing those, obviously, we're skirting some of the symptoms of depression. It also increases body temperature, which is an interesting one, which is known to have calming effects. And so many people will exercise and they sleep really well at night. If you do a good exercise that night, you will realize you sleep well. Often you think it's because you're so tired because you're exercised, but it's also the thought that it's because actually the increased temperature of your body has a calming effect. Um, so those are some of the physiological responses that we know happen with exercise in terms of our mood. Um, in terms of psychological and emotional benefits, which again, there's a lot of them. One of them is confidence. If you're exercising, you know you're meeting goals. Most of the time, to exercise regularly, it takes a goal, it takes a commitment, and so it gives you some confidence knowing you can do that. Getting in shape also makes you feel better about your appearance. Again, um, it helps you take your mind off of worries. It's a distraction, get you away from the cycle of negative thoughts. When I was typing up kind of what I was going to talk about today, I was thought back to a time when I was a teenager, and I don't remember what happened. I had a boyfriend, and I remember just being upset. I think that was the first time in my life I just wanted to go run. I grew up playing sports, but it was like, no, I'm just going to go run. And I remember running, and about a mile into the run, I just remember feeling so good. And I was so happy that I went on a run. In that moment, I was like, this makes me feel good. This makes a difference. So, again, it helps you take your mind off your worries. It's a great distraction.
Stress
Yeah, a
reducer.
stress reducer. Exactly. And often, and I was going to talk about this later, but I think these two kind of go hand in hand when we talk about stress, when we talk about depression. Fatigue creeps up, the issue of fatigue. Um, and often we're like, oh, we think we're so tired. There's no way I can exercise. I'm too tired to exercise. What's also been shown in many studies, um, and this particular study I wanted to bring up is in terms of chronic fatigue. So, chronic fatigue syndrome is they found that patients um, that did some kind of aerobic exercise at least 5 days a week um, with a maximum of 30 minutes, these patients were twice as likely as others who took flexibility or relaxation classes to say their symptoms had improved and that they felt better. A year later, three-quarters of the exercisers had resumed normal activities and some had returned to work. So, again, in terms of fatigue, often we think we're too tired, but actually, exercise improves our energy levels. Uh, So, a great benefit of
We've got
exercise.
about a
Yeah.
minute left. I didn't
Yeah.
know if there was anything you wanted to bring up in the last 60 seconds or so.
Yeah, so maybe just going back to some of the emotional psychological benefits, you get more social interaction. Often, exercise, physical activity get you the chance to meet, socialize with others, whether you're playing racquetball or if you find a running buddy or if you go to the gym or if you're playing tennis. Exercise generally puts you in places to become more social. And again, going back to coping, exercise is a great mechanism for stress reduction because it's a coping technique. It's doing something positive to help you manage your anxiety, helps you manage your depression. Often people will try to feel better by doing other things, drinking alcohol, dwelling on how bad they feel.
Mhm.
Situational things come up, and these are common ways that we self medicate ourselves. And I'd like, if anything, to encourage you or motivate you to instead of some of these negative things, try to cope by exercising, finding something you like to do. and get
Got good
moving.
weather here most of the year.
Yeah,
We
and
could
now it's
probably get
summer, so this is a
outside.
great time to talk about it too. So,
Well, Crystal, I'd like
yeah.
to thank you for coming by today.
Yes.
And maybe the doctor will let you do it more often.
Yeah, this was great. Good talking to you.
We've got a rotation now going on with all four
Yeah,
of you.
there's 4 of us, so good
We
providers.
should point out that because there are four people now working out of the office, that there is a lot more room for new patients and appointments.
That is, we're taking new
And
patients, and we also take same days. Most of the time, we try to leave openings for same day appointments. So,
excellent.
mhm.
Thank you for coming by
Thank you
again.
so much.
9 o'clock news is just ahead. It's 54, a very slow warm up today. It's 8:58. And of course, one more hour of top story ahead with Bill Colley right here on News Radio 1310, KLIX, and newsradio1310.com.